Welcome to Aging Gracefully's Mind Revolution podcast series, Brain Optimization Part 3, powered by AgeMD. In this final episode in our three-part series, we delve deep into the world of brain optimization at the Genesis Brain Institute with featured guest, chiropractic neurologist, Dr. Emily Kalambaheti. Get ready to be revolutionized and remember to take note that we care about you. Always consult a qualified, licensed physician or medical care provider and follow their advice. Now let's check in with our hosts, Brandy Nielsen and Ralph Smith.
Today, we're joined by functional neurologist and functional medicine hyperbaric clinician, Dr. Emily Kalambaheti, to talk about preventing cognitive decline. As the Director of Rehabilitation and Chief Clinical Officer of Genesis Brain Institute, Dr. Emily examines and treats patients with neurological conditions such as post-concussion syndrome, traumatic brain injury, cerebral palsy, and multiple sclerosis. Dr. Emily also speaks publicly about brain health, and we're so honored to have you on the show today. Dr. Emily, thanks for joining us.
Well, thank you so much for having me on as well, Brandy. I'm really excited to be able to touch on this topic, especially just moving to Florida again last year. It's something that is definitely one of my passions, is just ways that we can maximize our performance no matter what age we're at.
And that's exactly why we're so happy to have you on. I can't wait to dive in. Let me introduce also my co-host, my husband, Ralph Smith.
Hello, everyone. Nice to have you, Dr. Emily.
Before we dive into all that great stuff, why don't you tell our viewers and listeners a little bit about your journey to getting here and why you do what you do?
Of course. So my journey, like all good journeys, maybe had some twists and turns in there. I actually am from Iowa. I was born and raised there. I went to college there at the University of Iowa, where I got my bachelor's. I joined the Iowa National Guard when I was 17. So I definitely have my heart in the Midwest. But one thing that I did have occur in my family is my father has a traumatic brain injury. And my grandfather, who was the very first Dr. Kalambaheti, was diagnosed with Lewy body dementia. So just the thought that brain health has been in the forefront of my brain since I was a kid. And just knowing that when your brain doesn't work well, it can affect everything. So from there, my first move to Florida actually was after I got out of the National Guard. I decided to look into a way to help people that didn't involve drugs or medicine. After being surrounded by people in the medical field my whole life, my mom's a nurse, both my grandmas are nurses, my grandfather was a physician. I actually chose chiropractic. Having never been to a chiropractor, I just like the philosophy around helping people without drugs or surgery. And that's what took me to Florida. And then from there, the Carrick Institute to learn more about functional neurology. And then after that, it's just a non-ending path of learning and being excited by the new technologies that have been announced in the last 10 years, 5 years, 2 years. It's really an exciting time to be in brain science.
I can tell how excited that you are. It's exuding and coming out of you, your passion. So thank you for sharing that. First question right off the bat, what in the world is a functional medicine hyperbaric clinician?
So a functional medicine hyperbaric clinician is someone who is certified for hyperbaric oxygen therapy, being able to administer that and prescribe it to patients. And then we're considered functional medicines because functional medicine practitioners don't prescribe drugs, they prescribe supplements. So it's basically just a doctor that prescribes hyperbaric oxygen therapy that doesn't prescribe drugs.
Is it considered a supplement?
So it's actually really weird. Oxygen in America, despite the fact that we all breathe it freely all day long, is considered a drug at 100% purity, but a supplement at anything less than that. So it's really weird. As long as you concentrate it, and we concentrate our oxygen here to 98%, 94 to 98%, it's a supplement. But if you were to breathe in 100% oxygen, as for some reason, the Food and Drug Administration decided that that's when it becomes a drug.
Wow. I can't even wrap my head around the logic.
Oh, there's no logic there. It's
okay. Good. I shouldn't be able to wrap my head around it. Wow.
I was actually just going to ask, there may be some conventional wisdom that having too much oxygen could actually accelerate aging. Is there certain protocols that could actually slow down, or, we could categorize it as healthy aging?
Absolutely. And that's fair to say. Too much of anything can be harmful. I mean, even too much water can be harmful. You can overhydrate, right? So you can get too much oxygen. So we would never want anyone to live in a hyperbaric oxygen chamber. We normally do 1 to 2 hour sessions in there, and every 40 hours or so of therapy, you would get approximately a 1 month break. And the reason for that is, even though there's all these really awesome benefits of having oxygen and having that increased pressure so that the oxygen can actually dissolve in the liquid portions of your blood, oxygen creates oxidative stress, right? Oxidative oxygen. So some things that you can do, and that you're probably already doing, knowing how much you know about aging gracefully, is taking antioxidants.
That's right.
So one thing I recommend for my patients is, if they're going to be in the hyperbaric chamber and it's something that they know they're going to need long-term, in the sense that maybe they have a neurodegenerative condition, or maybe they're a kid and they have things like autism or neuroinflammation, and they're going to need multiple rounds of hyperbaric oxygen, I just recommend getting on an antioxidant. And honestly, with the stress that most people are under these days, it's not a bad thing to be on for most.
So it could actually be a therapy for preventive care, not just reactive care. If you're dealing with Alzheimer's or some type of trauma to the brain, that's one way of improving cognition. But the other is preventive care. If you're just want to improve, brain capacity or cognition, you could go there as a therapeutic on a regular basis.
Absolutely. And I will let you know, I do that myself. I have had my genes tested. I know that genetically, I have some weaknesses. So before I ever see any signs of cognitive decline, I'm getting the therapies that I would give somebody that would be in cognitive decline. An ounce of prevention is worth a pound of cure, right? I think Ben Franklin said that. So I'm making sure I'm getting the right amount of ounces of prevention in now while I can, so that I can prolong the necessity of it for as long as possible.
I love this. This is what our topic is about today: preventing cognitive decline. Let's talk about cognitive decline in and of itself for a minute. Explain what it is clinically, and share a little bit about why it happens, when it happens, to whom it happens.
For many people, there is this preconceived notion that as we age, we just become less sharp. And that doesn't have to be the case. But what can happen is, if you're not treating your brain, you don't eat right, you're under a lot of stress. And emotional stress is inflammatory like physical stress is. So just because you're not someone under physical stress doesn't mean that you're stress-free. You can still have emotional stress, right? So being able to do things to decrease that stress can be helpful. But as we age, we just get more put on our plate, right? You're dealing with, when you're a kid, you're stressed about your friends at school, right, and maybe getting good grades. And then you hit your 20s and 30s and you're getting stressed about finding your life partner. And then you're eventually, maybe you have kids of your own, or maybe you're stressed because you don't have kids of your own. But as these different stressors pile up, and as maybe some of those bad habits that weren't that bad earlier in life start piling up on one another, I used to work out 5 times a week, and then it was 3 times a week, and then it was, well, I walk my dog. Isn't that good enough? Well, all those little pieces do create a bigger picture. And what that can look like is neurodegeneration, or having different areas of your brain just be less healthy. So when we're looking at cognitive decline from a clinical standpoint, there are a lot of different cognitive tests or assessments that we can administer so that we can put numbers on that feeling of being less sharp. And then there's other symptoms that you can look for. Are you searching for words? Are you forgetting where you place things? And I kind of tell people too, cognitive decline is not just about memory. Memory obviously gets a bad rap because when you lose it, it's very obvious. But it can be things like spatial, like, not being as aware of your surroundings. It can be things like personality traits and inhibition, where maybe you start saying things that are not very appropriate, but your brain that's supposed to put the brake pedal on isn't healthy. Right. So it can be a very wide net to cast to say cognitive decline. It could be focus, it could be memory, it could be spatial, it could be how you're interpreting words, it could be how you're finding words that you're about to speak. But from a medical standpoint, you'll get diagnoses like mild cognitive impairment or symptoms involving the cognitive system. And they're just really vague diagnoses. But if you already have one of those diagnoses, it means that clinically they found something that is abnormal. It's not just standard aging. It's something above and beyond that. So I would say before that happens, start. But once that happens, start. There's never a bad time to start neurorehabilitation. There's never a bad time to start caring about your brain.
So important. We my wife and I, we're advocates of GEM and healthy lifestyle. And working out is part of our routine. We're intentional about it. Eating habits, we're intentional about it. It sounds like the more I'm learning about these types of therapies, we should and could be intentional about exercising our brain.
Absolutely.
Big takeaway for me. Thank you.
I think we're on the cusp of people caring about their brain just as much as they care about other parts of their body. But for a long time, they were getting told that the brain can't change, right? If you grew up and you went to school in the 70s, 80s, 90s, at some point, someone told you if you lost a brain cell, you're never going to get it back.
Yes. I have heard that lots and lots. Is that true?
No, it's not true. So we have brain stem cells up into our older years, but it doesn't always matter how many individual cells you have. It's how they're connected. And that's where the function comes from, the term functional neurology. I might not be able to change the way your brain looks on an MRI or looks, during some of the cadaver studies. But in terms of changing the electrical activity, changing the way the brain functions, absolutely.
Wow. And how? How do you possibly change the way the brain functions?
Anytime you have learned something in your life, that is neuroplasticity. So when you've learned something beneficial for you, or maybe you learned a bad habit, it's neuroplasticity. So the thought is, if I can harness this trait that all brains have and use it for good, we can make changes that are beneficial for you. And for some people, it's not just about making those connections. It's about making sure the brain's getting the right amount of fuel and stimulation. So the fuel component comes in with what you're eating, right? Your diet, your supplements. And then it also comes into play when we're looking at some of the therapies we have at Genesis Brain Institute, like the hyperbaric oxygen chamber and the photobiomodulation devices, which is infrared laser. So you can give the brain extra oxygen using hyperbaric oxygen therapy, and you can ask the cells in the brain to get more energy from the packets of light energy called photons that you can give the brain with the lasers we have, to make sure that the brain has the fuel that it needs. So then later on, when you stimulate it to create that neuroplasticity, it's healthier and it's able to make healthy connections that last longer.
Wow. Sign me up. I'm running over now.
I recommend it. Paying attention to your brain's always going to be beneficial for you.
Yeah. And you're here in Tampa, Florida. Yeah.
Yep. Yeah, we're on Rocky Point.
I definitely want to check this out. It's funny you mentioned it's not just about maybe forgetting where your keys are. All of a sudden, you're not aware or as aware of your surroundings. And that's interesting because I don't know if I've ever realized that I'm not aware, of my surroundings, but I definitely lose my keys, forget where I'm parked, even struggling to find the right words when they've been so common and I've said them so many times in my life. That happens to me weekly. And so what would that mean if that happened? I'm 56 and that happens to me on a weekly basis. Is that normal aging, or is it something that I should come in and get checked out? Because maybe it might be something more.
Well, I'd really love for us to throw the term normal aging out the window,
Ah.
right? You want to age gracefully. And is aging gracefully forgetting where you're parked?
No,
I'd say no,
no,
right?
it's not. I agree. I completely agree. Now you're speaking to my heartstrings now, because I say aging gracefully to me is doing something about it so that I can. Because if I don't do anything about it, I'm not going to age graceful, and it's not going to be a fun ride. And I realize that. So I love that you just helped me correct my wording there. It shouldn't be normal to, all of a sudden not find a word that you've said a gazillion times in the past. So that's huge for me. And I'm sure a lot of our listeners, depending on your age, but I don't know if that's even has anything to do with age in and of itself. I mean, what are some of the other reasons we might have this sort of decline? Is not to do with aging or not to do with the obvious brain trauma. What are some other things that cause cognitive decline?
One condition that is very common in America that people don't always associate with cognitive decline or memory loss is actually depression. So if you have had depression or anxiety or mental health conditions, the organ that's affected is the brain, right? So you already know that your brain's not healthy. Granted, maybe that's not how it's been explained to you, but it is the brain, right? The brain is in control of your emotions. Your brain has to create the neurotransmitters so that you can have all that beautiful serotonin and all that beautiful dopamine. So for a lot of people that have depression long term, even if you're getting it treated, you can notice that memory loss can be a part of that. Or with anxiety or ADHD, you can't make a memory if you weren't focused and concentrating when that information was provided to you. So if when you parked your car, you were anxious and your heart was racing and you were late for an appointment, you might not have taken in your surroundings to have data to pull back on for that memory later. And if you weren't paying attention to get the information to begin with, there's nothing to pull from. And it's not a memory issue, that's a concentration issue.
Okay, let's be honest. This happened to Ralph and I this morning. We went to the gym and parked our car. And then when we got out, we both forgot where the car was parked. And I'm thinking now, well, when we left the car, we're busy, we're on our phones, right? We're not even thinking about, we're just like, let's just get into the gym and this thing. This this will steal my concentration on anything, any moment of time. And that's exactly what happened to us. We weren't paying attention. Wow. Woo. Mind blow, but so obvious. Yeah.
So I want to get back to some of the therapies that you mentioned earlier, Dr. Emily, specifically the hyperbaric oxygen therapy. What are some of the side effects? Are there any known side effects or risk that our viewers should be aware of?
Yes, so there is, like anything, right? If it has the potential to help you, it always has the potential to hurt you too, right? So one thing with the hyperbaric chamber, especially this time of year and in the springtime, if you're congested and you can't get your ears to clear the way that they should on an airplane, you can't go into the chamber. Otherwise, you can hurt your eardrum. So it's called your tympanic membrane. So that is something that even if you do get it hurt, it will heal. It's not life-threatening by any means, but that's something that I tell my patients. If you've had a history of having one of your lungs collapse, then you're not a good candidate for the hyperbaric chamber because your lungs need to be able to fill with the oxygen and you need to have good full breath. So people that have COPD or things like that, I recommend finding other therapies as well. But the good news about a lot of what we do here at Genesis is that the risks are quite low. And as long as you have a doctor who's paying attention, which I promise you, when I talk to you about remembering, like I'm so focused on my patients that I'll have people come in like, do you remember who you saw at 1 o'clock yesterday? And I'm like, oh, you mean Mr. Smith? Of course I do, because I was so intent in my focus and concentration with that patient during that time. So I do pay attention to my patients to make sure that I'm screening them. And if they do have any lung issues, I ask that their pulmonologists just provide clearance so that the whole team knows what that patient's doing. And then for a lot of our other therapies, the biggest risk, they're going to make you tired. It's like a brain workout, right? So you get fatigue, and sometimes patients will get a headache. But the good news is it's nothing a good old-fashioned nap can't take care of. So it's really low risk, all things considered.
That's good to know. Thank you for sharing that. I'm actually considering it for myself. As Brandy alluded to earlier, we're both kind of, we're good candidates for this. I think anyone, obviously as we're aging, we could all be intentional about exercising our brain or receiving oxygen therapy. But, some of these other therapies that you're offering at Genesis Brain Institute, like the virtual reality feedback, am I pronouncing that correctly? Biofeedback?
Biofeedback. Yep, we have biofeedback and neurofeedback here. So
What's
the biofeedback is a great way of helping you be more cognizant on your heart rate and your breath rhythm, which is great for people with anxiety, great for people with PTSD, because we can put you in virtual reality so that you're physically safe, but you're kind of getting triggered by the virtual reality. We can, if you had like a car accident, we can put you in a driving scenario. Or I have one patient where I know he probably does not love it, but I make him listen to people arguing because that's a big trigger for him. And then he can see his heart rate, see his breath rhythm, and become more in control of that. Neurofeedback, on the other hand, utilizes electrodes over different areas on your scalp to read your brain waves. And then we provide feedback so that your brain starts learning how to be in a more beneficial brainwave state.
Share a little bit about the feedback. What does this test tell you? Give an example of a result and some feedback you would give to a patient on what they can do about it.
Well, the fun part is that it's not feedback like I'm telling you to think harder or do better. It's feedback that is almost subconscious in a way. So you're just listening to music or you're just watching a Netflix video. And as your brain gets in those ideal states, it's crystal clear. You can see it, you can hear it, everything's fine. As you start falling out of that ideal brainwave state, the sounds will get dimmer and fade, or the screen will fade to black. And your brain will actually start learning utilizing operant conditioning, kind of like Pavlov's dogs, right? So what will use operant conditioning, your brain, without you realizing it, will start putting itself in the good brainwave state so it can get its reward of crystal clear music or a nice bright computer screen.
Wow. Without revealing patients, of course, can you share an example or two of a patient that you've helped and where they were when they came in and how much better they're doing because of the treatment you've provided?
Oh, there's a lot to choose from, to be honest with you. I think one that stands out when it comes to cognition and aging, I have had a patient that I saw that had a stroke in his frontal lobe. So it's aging, in the worst kind, right? It's pathological. So when we were first seeing him, he was having a very hard time being able to judge appropriateness, which in today's day and age, if you need to be on the ball when it comes to being appropriate, right?
Yes.
So he was having issues that was really, the issues were really alienating him from his family because his family didn't want him to be around the grandkids, didn't want him, to be able to just live his life the way he wanted to. But I also can see it from their standpoint. They don't want their kids exposed to certain words or certain actions. So that's understandable. But one of the things that was really cool is we did rehab with him. And then, I get that 3-month follow-up just to make sure everyone's still on track, right? See if they need more. And he was doing really well. And he said that they haven't had any incidences since treatment that made anyone uncomfortable or anything like that, that It was almost like life was going back to normal.
Wow.
Really good to hear.
So encouraging.
Yeah, absolutely. Stroke, you say. I'm not sure, when you mentioned it was in the frontal lobe, what's the difference between having a stroke in the frontal lobe versus another area in the brain?
So the different regions of the brain are going to be in charge of different functions. There's always that crosstalk, but the very, very front part of your brain, called your prefrontal cortex, is where reward processing, decision making, motivation is going to come from. As you get further back into the back part of the frontal lobe, that's where we get our body movements. And then into the parietal lobe, we get our sensory, occipitals, where we get vision. Temporal is memory and sound. So it really just lets clinicians know, or people know, okay, if this is the region that's injured, these are the most likely symptoms the patient's going to have. But ultimately, every brain's different. Your brain is as unique to you as your fingerprint.
Yeah.
So being able to get the data from a bunch of different tests, not just a single test, helps us create a picture of your brain and how it's functioning. And then being able to customize the treatments based on that is, in my opinion, what's necessary. But I would say is what you deserve. If your brain's different than anyone else's brain, don't you deserve a treatment plan that's different than everyone else's treatment plan?
Absolutely.
It's so funny how I've never actually thought of this before, but it makes so much sense. I mean, it's just as important as exercising your body. It's important as waking up and breathing or eating or something. I don't know why. Well, you're explaining why a little bit about why I may have never thought of that before, because it was never even introduced to me, throughout my whole life. And growing up, the brain was just the brain. It wasn't the muscle, right, that you can work out. Or my whole world is getting spun around right now with this awesome information and learning. Ralph, we definitely have to go together and try this, because I really care right now. As I said, I'm 56. I want to be as vibrant as I possibly can when I'm 66, 76, 86, because those are the years, if I'm going to retire in those years, and they're supposed to be the best years of my life, I want to experience the best of life in those years. And I can't imagine if I get up into those years and I'm retired and I can't enjoy life because I didn't do anything about it before I got there. And that's the whole point. That's the point of Aging Gracefully and why we're having these conversations here. So thank you for that incredible insight and giving me a greater understanding, and for our viewers and listeners too. Now, if you don't mind, you mentioned that your dad was it a traumatic brain injury?
Yes.
And was that while you were a young girl, or tell me a little bit about that?
It was actually a bit before I was born.
Oh,
so
wow.
My whole life I have been in the world of brain health.
Okay.
Which I do think it's a unique experience. I wouldn't necessarily wish it on anyone, but I do think that it allowed me to have this viewpoint from an early age. I know some people comment, I do look kind of young, but on the side of doctors, I found my passion very young.
Yeah.
And I have not looked back. I haven't even side looked at other career paths, because I knew I wanted to help people that had brain injuries. And I feel very fortunate that from an early age, I saw how amazing the healthcare system can be at keeping people alive, but perhaps some of the downfalls of optimizing performance or striving for that next level. And that's where I do feel that Genesis Brain Institute has been just so amazing at looking at people and saying, what more do you want? What more can we do? How can we help you achieve that? Instead of just saying oh, you hit average, that should be good enough. If you have a brain, you can make it work better. I don't care if you're 4 years old or 104 years old. If you have a brain, it can work better. If you have a body, it can be healthier. And I really think we're on that cusp of that revolution.
Now, as you were coming up and experiencing this with your dad, how have you seen the treatments change over time?
Treatments were stagnant for a lot of years. I'll be maybe a bit too honest. But ever since the 2000s hit and we started having better ways at measuring the brain function, like QEEGs, like fMRIs, like SPECT scans, now all of a sudden, instead of just taking like a picture of an organ in that one moment, we can start seeing how it's functioning. And from there, the treatments took off. Because there's no, I mean, maybe not for me, but for businessmen, there's no point in funding a treatment that you can't see the results of. Well, now we can see the results, right? And sometimes, when you're looking at prevention, well, yay, you're not any worse today doesn't sound very good.
Right.
But yay, those subclinical findings that were probably really going to be harmful in the future are no longer there. Like, that's something we can celebrate. So being able to catch things early because we have better technology has really elevated the entire scientific community's view on neurological rehabilitation in the last 10, 15 years.
I so appreciate your honesty and your passion, just that part of you, your belief in what you do. I really hope that you have impacted viewers and listeners today in such a way that they feel changed and that you've given some hope and inspiration to somebody right now. You have with me, and I so appreciate it. To think about being able to get healthy when you're older even is just, it's very encouraging. And thank you for sharing that with our viewers and listeners. Why don't you share also how our viewers and listeners can find Genesis Brain Institute, or how they might be able to even connect with you?
Of course. Our website is www.genesisbraininstitute.com. You can also find me. The good news about my crazy last name is there's not many of us. So
can you say it again? Because I forgot.
Okay.
Is that bad? Do I need to come in and
that'll be our litmus test. If I can get you healthy enough that you can remember my last name, we'll know we're on to something. No, but it's 11 letters of fun. The last name's Kalambaheti. Luckily, they just have my email as dr.emily, so dr.emily at genesisbraininstitute.com. You can also always give us a call as I slide to my business card to look at it really quickly. 833-282-7246. So give us a call or come to our office. Like I said, we're at Rocky Point. It's a beautiful facility. And we have the most amazing team here of people that are really doing this because they believe in what we're doing. Almost all of my neurotherapists that work with me are military veterans. The people that join our team for marketing do it because either they or a loved one have or are getting treatment. It's amazing getting to work every day here. It's amazing getting to do what I love. And I know you said that you can see the passion on my face. When you get to work with people every day and help them feel better, help them be better, help them like being alive, enjoy it, enjoy the little moments.
Yes.
There's not anything better than that. So I feel really lucky. So even if you don't get treatment, come tour the clinic. The listeners or Brandy, Ralph, we're more than happy to have you here. And then, of course, I'd love the opportunity to help you optimize your brain function too.
Thank you so much, Dr. Emily. And just for everyone, just for clarity, it's Tampa, Florida, Rocky Point, Tampa, Florida. We have viewers all over the country and even all over the world. And I just want to be crystal clear. Genesis Brain Institute, Rocky Point, and Tampa, Florida. Thank you so much, Dr. Emily. It's a true honor to have you on our show today.
No, it's been my pleasure to be here. Thank you so much for the opportunity.
And of course, we want to thank our viewers and listeners for tuning in. And I want to encourage you to subscribe to the Aging Gracefully podcast and join us in exploring the latest developments in healthy aging, anti-aging, and innovative treatment options. Stay young, stay healthy, and stay tuned. Till next time.